Coming up on Harvard Chan This Week in Health, the impact of a historic presidential election in the United States, how a Donald Trump administration could reshape healthcare. Plus, your phone knows how you feel.
We actually spend a lot of our waking hours interacting with this device and interacting through this device. Every one of these interactions in isolation is just a small digital breadcrumb, but if you aggregate them together, you really get to see a pretty detailed picture of a person.
How researchers are mining data from our cell phones to improve everything from our mental health to recovery from surgery. Hello and welcome to Harvard Chan This Week in Health. It's Thursday, November 10th, 2016. I'm Noah Levitt.
And I'm Amy Montemuro.
We begin this week with a look at how Donald Trump's victory in the presidential election could impact healthcare in the United States.
Trump has repeatedly vowed to repeal the Affordable Care Act, which has helped provide insurance to more than 20 million Americans.
During a recent event at the Harvard Chan School, John McDonough, professor of the practice of public health, offered a glimpse at how President-elect Trump and congressional Republicans might try to dismantle the ACA. Take a listen.
And I think we can anticipate, and it's not a secret, a significant effort early in the year quickly to dismantle key portions of the ACA. Speaker Ryan has announced in September that if that's the environment, he will move very quickly on a reconciliation bill, which can't be filibustered and only requires 51 votes in the Senate, to take apart the key financing features of the law as it pertains to the health insurance exchanges, a little ambiguity about what they will do about Medicaid. But they have been saying this, and just the other day, Mr. Trump said that if he's elected, he will summon a special session of Congress as quickly as possible, and the object will be to repeal the ACA. A lot of people say, they can't really mean it. They really wouldn't take health insurance away from 20 million people. How many times do they have to say it before we take them seriously?
If you want to hear more from that event and how the election could impact healthcare across the U.S., we'll have a link on our website, hsph.me/thisweekinhealth.
And several key public health measures were on the state ballots. Voters in several California communities and Boulder, Colorado, approved new taxes on sugary drinks. Recent research from the Harvard Chan School showed that those taxes would reduce cases of obesity and diabetes and lower healthcare costs.
Also in California, voters approved a $2 per pack increase in the state's cigarette tax, and voters in California joined those in Nevada and Massachusetts in legalizing recreational marijuana use. Meanwhile, voters in Arkansas, Florida, and North Dakota okayed medical marijuana. Amy, I'm going to ask you and our listeners to envision a scenario.
Okay.
You've just had surgery to remove a brain tumor. You've recovered in the hospital, and then you head home, and then you get a text from a friend asking how you're feeling.
Hey, how are you feeling?
Okay, some pain.
So maybe that's a few days after you return home, and then a couple of weeks later, another text.
Just checking in again. How are things going today?
Much better. I've been able to start cooking again.
And then a few weeks beyond that, you get one more text.
I heard about your surgery. How are you feeling?
I'm doing well. There's very little pain. Today I was able to get outside and walk around the neighborhood.
These conversations and the progression can actually tell your doctor a lot about your condition.
So the simple act of just typing a text message actually requires a ton of things to come together.
That's JP Anella, an assistant professor of biostatistics at the Harvard Chan School.
He runs a lab that collects smartphone data and extracts insights about human health and behavior.
So back to that brain tumor example and why text messaging can be so insightful.
You need to have something to say. You need to be interested in saying something. You need to be able to see. You need to be able to type. So actually looking at things like how long does it take for a person to respond to a text message? How long are these messages in terms of number of characters? How frequent are they, and so on? I think all of these will provide very interesting and valuable information about a person's social and behavioral state. So initially you might assume that a person, if they're just recovering from major surgery, they might only send out very short messages, yes, no, doing okay, and so on. But as time goes forward, if they start to recover better, their text messages might become more frequent, they might become longer, and so on.
All of this is an example of something called digital phenotyping, and that's what we'll be taking an in-depth look at today.
So what is that? Well, the traditional definition of a phenotype is that it's a collection of an organism's many traits, such as its anatomy or hormone levels or its behavior.
So, digital phenotyping involves mining data from electronic devices, such as smartphones, and using statistical tools to extract insights about a person's behavior. And this is significant, says Onella, because behavior has typically been very difficult to study, because it's dynamic, it's always changing, and it's context dependent, which means our behavior changes depending on the situation. Again, with that brain tumor example, your behavior will be very different after the surgery compared to before it.
And this is why smartphones are such a powerful tool. Everything we do, using our GPS for directions, making a phone call, texting a friend, they all leave behind these digital breadcrumbs. On their own, they may not tell us much, but taken together on a larger scale,
if you aggregate them together for, a day or a week or a month, you really get to see a pretty detailed picture of a person.
And those are just the active things we're doing on our phone. But it's the passive data that can really tell a story.
And this is why smartphones are more powerful than something like a Fitbit or another piece of wearable technology. Onella says that after a few months of usage, people use those devices less frequently, which means they're collecting less data. But that's not a problem with phones, which people are always using.
And our phones are always collecting information, even if we don't realize it. For example, doctors can have someone with depression complete a survey about their behavior, but looking at phone data can give remarkable insight into a person's sleep habits.
So just to give you an example, in a typical hour of a day, your smartphone screen might be on 10 times or 50 times. But during night when you're sleeping, it's almost never on. The only time it would be on if somebody sends you a message in the middle of the night. So just by looking at the frequency of screen on-off events alone, we can get a pretty good estimate of how long you're sleeping and whether you woke up in the middle of the night. Now, if we combine this with other layers of data, we can get even more precise estimates.
But this smartphone data is really only one part of the picture.
Where the real breakthroughs happen is when researchers like Onella can take the smartphone data and marry it to clinical information, things like blood work or lab test or surgical outcome.
So if we return to our brain tumor example, we can see this in action. Onella and his team are working with Tim Smith, a neurosurgeon at Brigham and Women's Hospital. After a patient has surgery, they'll complete surveys with Smith's team explaining how they're feeling, and they'll also have follow-up in-person visits.
But what about all that time at home? That's where Onella can use smartphone data to fill in the gaps. We gave the text message example, which measures cognitive functioning, but there are other things to look at as well.
So in this particular study, for example, one of the key sensors we're using is GPS. We would expect that the person, right after surgery, they will be at the hospital. Once they're released from the hospital, they will likely stay in their home for several days. They will not be leaving the house. But we can learn things like, how long do they spend in their house? When they leave their house, how long are they gone for? How many different locations do they visit? How far do they venture out from their house?
So there's all this data out there, so how do scientists like Onella actually collect it?
Well, they've gone beyond creating a simple app, and they've developed an entire research platform. It's called Biwi, named after the Nordic goddess of sunlight and mental health.
And it's particularly powerful because Onella and his team have designed it so it can be customizable for each study. So let's say a surgeon like Tim Smith from Brigham and Women's wanted to measure GPS data, text message length, and phone calls. Each patient would then download a customized version of the app that would collect only that information. Onella explains how that works on the patient side.
And so what happens is that when we enroll patients in our studies, patients get a unique Biwi ID number, which is just, let's say, ABC123 or something like that, and they get a temporary password. And with these two pieces of information, they can go to iTunes or iStore, they can download the app, and they can enter their details into the app. And based on the Biwi user ID, the system automatically gives them the right version of the app. So basically that connects them to the right study. So they get the right questions, they get the right kind of passive data collection, and so on. And Biwi uses what's called store and forward architecture. So the idea is that the data are initially stored on the device, and next time when a Wi-Fi network becomes available, then the data are uploaded to the study server and erased from the device. And the data are always encrypted, and this is critical, especially for a biomedical context. So to preserve patient privacy, we first hash all identifiers, and on top of that we have a second layer, which is very strong encryption.
Anella said it's actually been fairly easy to recruit patients for these studies, especially once they know what data will be collected and how it will be used.
And so you might be wondering, when will I be able to download an app like this and use it?
It turns out that's still pretty far away, but Anella says that in their current studies, they're working on ways to integrate reports generated from smartphone data into one-on-one patient care.
But the idea is that perhaps once a week or once every 2 weeks, we can take the data that we have collected from a patient and we can produce, say, a one-page report that tells something about this patient's mobility, their appetite, their mood, their social connectivity. And then the doctor can look at that report and discuss that the past week or past 2 weeks with the support of having that extra document there.
Anella's goal is to make this BWE platform open source by 2017, which means that other researchers can use it for their own studies.
And widespread adoption opens the doors to some incredible research opportunities, says Anella. At the heart of it is that passive data we talked about earlier. Because patients don't technically have to do anything, researchers can do incredibly long follow-up times, from 6 months to a year or 2 years. All the patient needs to do is to keep the app installed on their phone.
The technology also offers doctors and researchers an opportunity to get a picture of a patient's life before they became sick or injured.
So typically, we only get to have the post data. So I go to see my doctor after I've hit my knee or my back is hurting or my head is hurting. But typically, we have no data from what happened before. And the nice thing about the approach of digital phenotyping is that we could potentially instrument a large cohort, say 10,000 people or more, and then also have the pre-data. So we'd have the data from a person before something happens to them, before they get into a car accident, or before they hit their knee, or whatever the condition is. And I think this is potentially very valuable.
Another group that could benefit? Scientists studying the environment and exposure to pollution.
So, for example, you could imagine a study that follows people, uses their smartphone, GPS to track their mobility patterns, so we can learn where these people are located physically at any point in the day. Now, if we have some kind of estimates of exposure to pollution at those locations, we can essentially calculate, reverse engineer a person-specific exposure to, say, whatever the pollution you're interested in or particle you're interested in. And that's essentially your custom-made daily exposure to the environment.
As we talked, Anella emphasized the importance of collecting raw data from devices.
Not only does that make the research he mentioned possible, but it will also make it easier for scientists in the future to replicate studies.
And we know from a fairly recent study that about 2/3 of studies, medical studies, are inconsistent when retested, and only about 6% of studies are completely reproducible. The reason for collecting raw data is that we or somebody else can later reanalyze the data using whatever methodology they want to use. But also what's important is that if we relied on a proprietary summary statistic of someone's mobility, for example, what if that summary statistic changes in the middle of a study? So for example, if Google or iPhone or Apple, they decide to change some of these summary statistics that are proprietary, we would never find out. One day it would just seem that 250,000 people in the United States are now walking 20% more. And this is obviously a problem. And actually, one of the features of our platform that we're building in now is one-click replication. So we were inspired by Amazon's one-click purchase button. The idea here is that the platform stores all the key settings of a study. So if you wanted to replicate my study next year, you would have to only find my study in the list of studies, click that, and you would essentially immediately be able to run your own study, which uses the exact same settings for data collection as my study. So the idea here is to make the system as transparent as possible and to make it as easy as possible to replicate existing studies.
Anella wants to make it clear that there's no financial gain here. No one is buying or selling this data. And the goal, he says, is to simply better understand behavior and hopefully develop better treatments or interventions based on that information.
Before we wrapped up our conversation with Anella, we had to ask him, does mining all this smartphone data make him think any differently about the way we all use our phones?
I think I've become a little bit more observant about the ways people use their phones, and sometimes I see people walking around, even in Longwood, and the people seem to be glued to their smartphones. And I'm thinking, wow, this is going to be great data for us. But at the same time, I'm worried about these people walking into buildings or being hit by someone. So it's almost gotten to a point where we become so dependent on these devices that it does make me think about the future, but it certainly is an opportunity for us to get very rich behavioral data.
So keep using those devices, but maybe avoid texting and walking.
Always very sound advice. And if you want to learn more about Anella's work, you can visit our website, hsph.ma/thisweekinhealth. And just a programming note, next week we won't have a new episode, but we will be replaying last year's great interview with Gary Adamkiewicz, Assistant Professor of Environmental Health and Exposure Disparities, and he'll be talking about sustainability and Thanksgiving.
We'll return with a new episode the week of November 21st, and we'll be talking about Thanksgiving with Guy Crosby, an adjunct professor in the Department of Nutrition and science editor for America's Test Kitchen. He'll be sharing some of his best tips and tricks for cooking the perfect Thanksgiving meal.
So you have those 2 episodes to look forward to in the coming weeks, and that's all for this week's episode. I'm Noah Levitt.
And I'm Amy Montemuro. A reminder that you can always find us on iTunes, SoundCloud, or Stitcher.